setting expectations. I think you as a clinician need to be the coach that needs to tell your patients what to expect in their
Mm,
care. And we so often neglect to do this, where we are feeding off patients' prior expectations, even if those prior expectations are not viable or not reasonable, because we are accommodating. We are trying to please instead of being professionals and coaching what to expect in the future delivery of care, or what is your plan of care going to look like? Why do you need to be present and compliant? What does your compliance mean to your recovery? What is the threshold for your recovery? What is the expectation of prognosis to your recovery? That is what professionals do. That is what expertise allows you to do. If you have someone who is medically frail with multiple comorbidities and is morbidly obese, recovering from joint arthroplasty, you can set expectations to be lower because of these comorbidities. And that's just being a professional, outlining some of the facts. Now, communicating with a patient to expect your length of care is going to be longer because of your comorbidities. Your clinical recovery may be suboptimal because of some of the physiological factors that are involved in your care. And you can expect a higher level of independent involvement if you're looking to prognostically elevate your clinical outcomes. But as clinicians, we don't do that, right? We receive patients because they're being referred to us. And then it's almost like getting manna from God, right? Like it's like somebody sprinkled this manna and like, yes, I eat again for a day. I'm so happy. Eating a day for a day doesn't sustain your hunger for a lifetime. That doesn't get you to where you need to be. As a professional, you take ownership of your patients, you start coaching them. But then if you're in a clinic with other clinicians, you become the quarterback of that change, right? Like you are the agent of change, where you address it with other clinicians. And if there's rigid clinicians that say, no, I did not train for a physical therapist to do this, I am just an extender. Is that the person you want to have as part of your team? Like, especially if you're a progressive clinician, right? Then maybe that's not a clinician that needs to be a part of your team. Maybe that clinician can fulfill a different role. But we're talking about progressives, Dana. We're talking about clinicians that see that in 2025 we are at this cusp, right, where we can either grow
that's
or
right.
we continue to decline. And I would hate to see our professional decline, because we are too good. We provide too much value to healthcare. We provide too much value to our patients to just watch ourselves fizzle away and watch other industries keep chipping away at our autonomy until the point where we become what we were 7 years ago, which that would be unfortunate.